Hello and welcome to In Focus. I'm Anthony Moreno. Earlier this year, nmpolitics.net was awarded a grant from the Fund for Investigative Journalism to examine issues within southern New Mexico's behavioral health system and also to explore solutions. The grant and investigation awarded to the news site has turned into a collaboration of journalists from nmpolitics.net, the Las Cruces Sun News, and KRWG News. Joining us to share more about the grant and the collaboration of investigative work here is Heath Haussamen. He is editor and publisher of nmpolitics.net. Thanks for joining us.
Thanks for having me here to talk about it.
I'd like to start off with what are your hopes that this grant can provide with shining some light on the issue of behavioral health in our state?
I think it's pretty clear. We can see it on our streets. We see it in the headlines that we have a problem in this community with the way that we are addressing this issue. And I think local policymakers have a bunch of ideas for what we need to do, but there hasn't been the political will or the collaboration to make it happen. So I think I'm really hoping we can put some of this together in a comprehensive way and look for solutions. Okay,
now one of the specific stories that really caught your eye when thinking about this grant and investigation was last year, the shooting death of Juan Gabriel Torres by the Las Cruces Police Department. What is it about that specific case that you think really kind of encompasses all of the issues with the behavioral health system here?
You know, I filed a records request with the Las Cruces Police Department and the other local law enforcement agencies for any police reports in his history after he was shot by police on the Loman Bridge, just to see what was there. I'd been looking for, and almost hoping I didn't find one, but since the governor froze Medicaid funding for behavioral health services in 2013, I'd been looking for a narrative that would help illustrate what's been happening in our community. And I found it in his, unfortunately, but there are so many police reports going back maybe 15 or 20 years about substance abuse and alcohol, and even a few months before he was shot on the bridge, there's a police report where he essentially egged an officer into arresting him, and what he told the officer, or the officer reported, was that he wanted to be arrested so he could go back to the detention center where he could be treated for his meth addiction. So it seemed like a pretty good illustrator of where a community is at, and we've got to start with a realistic view of where we are before we can figure out how to improve.
Looking at this case, what are some of the questions that you hope can be answered in dealing with behavioral health here?
I think we're limited a little bit with a specific person's case by federal health privacy law, but certainly there, and it was reported at the time that he was not supposed to be released from the detention center the day that he was on the streets and ultimately shot by police. There's something in the system that failed there, and he was released even though he shouldn't have been. So we're looking to get it to the bottom of what happened there. Is there some procedure or something that can be fixed there so that doesn't happen again? And then, that's a springboard to what are all the other things we need to work on here? Was he receiving behavioral health treatment anywhere? Did he have access to it? Was he on Medicaid? I think we're looking both to look for numbers that will help quantify the problem in Doña Ana County, but also through this man's story and other stories we may find to qualify, to put human faces on it and tell real stories that illustrate what happens when things go really wrong. And his is a worst case scenario of he was not supposed to be on the streets. We have evidence that he sought to be in jail so he could be treated for a drug addiction, and it didn't work out that way.
Now, you brought this up earlier. You talked about the Medicaid freeze. I know you've covered that extensively in the past when it was happening, and how it's impacted the state. Let's talk about that a little bit, about what role you think the Medicaid freeze really played and still plays perhaps in providing behavioral health services here.
Yeah, I continue to hear from providers and people who work for behavioral health providers that the problems are substantial, that when the governor froze that funding to 15 nonprofit, and I think a couple of them were for-profit behavioral health organizations statewide, it wiped out the system in a lot of ways. And those 15 organizations, if I remember correctly, had provided about 80% of all Medicaid-funded behavioral health services statewide, so treatment for depression, suicidal thoughts, bipolar or other types of diagnoses like that. we are still struggling. The CEO of La Clinica, who had taken over, first we had Southwest Counseling and Families and Youth in 2013. Southwest Counseling just went out of business. Families and Youth, I think, still exists but doesn't provide those services anymore. We brought in a Tucson company. After a couple of years, they left the state and said, this isn't working. Now it's La Clinica doing it. Their CEO resigned last month, and they're looking for a new one. What I think we're continually hearing is there are not enough providers. There are not enough staff at those providers. The state has changed some of the formula for like length of appointments or whether you get an individual therapy session or a group session. So the quality, they may have numbers that show more people are being treated, but I think there are also real questions about the quality of that treatment. And I keep hearing that it's not anywhere close to where it needs to be.
One of the things that we constantly hear in New Mexico is that it's a poor state. Obviously, the state is going through a budget crisis right now, and it only has one hospital that is ran by the state. Through the work that you've done so far and the people you've talked to, how do you think that lack of state-run facilities in the state and is playing a role?
Yeah, I think Carlos Lopez, who works for the Las Cruces Sun News and is one of our reporters working on this project, has been looking at this, and I think some of what we're finding is that first of all, there are not enough beds at that one facility in Las Vegas. We've known this for a couple of decades probably. It delays people's right to a speedy trial. It keeps them in jail. In a lot of cases, they could be awaiting a competency hearing and sit in there longer than they would stay in prison if they just pled guilty to whatever charges they're facing. And so the state knows it needs a second hospital. The city of Las Cruces, I think some of the officials there have expressed a willingness to talk about, can we work together on putting it here, maybe find different sources of funding. It makes sense that one of them be in southern New Mexico anyway. And this is kind of the medical and population center down here. So there seems to be general agreement it needs to happen, but yeah, we have a budget crisis right now that is not resolved, and the idea that the state's going to come up with new money, it's kind of a discouraging topic right now, I think, for people that know we need to build this.
One thing that many folks in Doña County may find discouraging is the fact that there is a crisis triage center that was built by the county just outside the detention center in the county. It's been sitting there empty for a number of years. What do we know about when is that possibly going to be operational? I
don't think we do know. I think it was jointly built by the city and county, but the county is responsible for running it, and it's been sitting empty for, I believe, more than 2 years. And that's not a long-term treatment facility, but it is, if you get in a crisis, rather than locking you up in jail, if we needed some kind of diversion program or a short-term place for someone to be stabilized, and we just don't have a timeline for opening it, I think the community expected it to be open a couple years ago. So that probably would have helped with the impacts of the Medicaid freeze on these behavioral health agencies and maybe lessen that blow a little bit, and instead it was just one more blow.
Now, this is an investigation that is a collaboration. What are your hopes for not only this investigation, but also the hopes of providing or shining some light on some possible solutions to face this issue?
I think CARE2BG, the Las Cruces Sun News, certainly and in politics, we all want to be doing these big projects. Most people I know got into journalism to do things like this, but we all struggle with capacity. And so the theory behind this grant was if we work together, we can make it happen. And in the case of the Sun News reporters, they're doing some of this work outside their time on their own jobs. So they're working really hard. Everybody's working really hard at it. But my hope is that by asking the deeper questions instead of just covering the day-to-day stories, by considering what's happening in other states that's working, or other communities in New Mexico, how can we push the conversation further than it's gone this far in Las Cruces and in southern New Mexico, and hopefully actually help spark change.
All right, well, Heath, thank you so much for being with us on In Focus. And if you want to share your story about dealing with the behavioral health system here in southern New Mexico, please contact Heath Haussamen at nmpolitics.net. And you can also contact us here at KRWG by sending an email to feedback@nmsu.edu, or contact us through social media. You can like us on Facebook and follow us on Twitter to reach us and also to stay updated on the latest news. We hope to hear from you, and thank you for joining us for In Focus.